Hey everyone, Dr. Aaron Moreland here with Vallejo Health and Wellness Center in Eden Prairie. I just got done working with a new patient. She came in because she was dealing with some pretty significant neck pain. She said it's waking her up in the middle of the night, saying that it's pretty tight here, also tight at the very base of her neck, causing a lot of tightness that wraps around. And so she came in because she was dealing with some neck pain, and we did tests and found out, yeah, there's a lot of things going on there. But we don't just ever look at the neck. And so I also looked at the rest of her spine, started down at her feet, working up into her pelvis. And what I noticed was that a lot of rotation. She had been to other chiropractors, been to other physical therapists, and they said she's all kind of twisted in her pelvis. They said that the part of her pelvis was, the left side was pointing forward, okay? And so I did notice that. But then when I did some further testing when she was on the table, I noticed that when she was lying down that she had her left leg was quite a bit shorter than her right leg. And even though when she was standing, her pelvis was nice and level, when she was lying down, there was a difference. And so I started feeling around, started feeling the QL, which is a muscle that's right here in the low back. Also started feeling in the front of her spine, her psoas muscle, and it was really tight in there. So that psoas muscle, it attaches to the front of the spine here, but then also it's called the iliopsoas muscle. It attaches to the front of the pelvis here, and it might have been what's causing her pelvis to pull forward. And that's not going to just impact her pelvis, it's also going to impact her neck. And so we released the psoas muscle, released the QL muscle, did some work on her glutes, and I could see a difference that when she was lying face down, didn't have that leg length difference anymore. And so that could be impacting her neck. Now, like I said, I did work on some other parts of her neck as well, but we don't ever just want to look at where it hurts. We don't ever want to just look at where the patient is telling you what they're feeling, because that problem could be impacted by something else, or it could even be causing something else. In her case, I think that it's playing a big part in it. I don't know if it was caused by it, but I don't think it's helping what she's dealing with in her neck. And so we released that. She got off the table, felt a lot different, felt a lot better. And so we're going to keep working on that, see if we can get those muscles to relax, which is also going to help with her overall pain. So again, we don't ever want to just look at one place where the person is in pain, because then you might miss some other things that are causing that pain, that are driving that problem. We want to get to the root cause. So that's what we do here at Vallejo. It's a little different than what we see at many other offices. This lady had seen many other doctors already and still was in significant pain. So hopefully we're on the right track with her, and did give her some hope. So again, my name is Dr. Aaron Moreland with Vallejo Health and Wellness Center. Hopefully you're having a great day. God bless.